Cognitive Behavioral Therapy, a complete guide to overcome obsessive compulsive disorder, bipolar disorder, and schizophrenia. Written by Franz Bement. Narrated by Justin Roberts. Introduction. Cognitive behavioral therapy, commonly referred to as CBT, remains the treatment of choice for obsessive compulsive disorder, OCD, here in the UK and is available through the NHS. It's important that those struggling with OCD try to understand the principles behind CBT. CBT is used successfully as a treatment for many psychological problems, including OCD and other anxiety problems such as panic, post-traumatic stress disorder, and social phobia. It also figures in the treatment of eating disorders, addictions, and psychosis. CBT is a form of talking therapy. However, unlike other talking therapies like counseling, it is much more structured and tailored around the individual's here and now problems, and rarely focuses on their past. CBT is also meant to be a short-term therapy lasting weeks and months rather than years. While we are always open to other therapies, for the majority, the evidence shows that CBT is the treatment of choice for OCD. Research has shown that 75% of people with OCD are significantly helped by cognitive behavioral therapy, with some local IAPT services reporting recovery rates of up to 80%. What's more, this form of therapy does not have any risks or side effects associated with it. For this reason, it remains the treatment of choice for tackling OCD by the National Institute for Health and Clinical Excellence, NICE, and specialist centers such as the Center for Anxiety Disorders and Trauma, CADAT. There are also no limits on how many times you can try CBT. What we mean by that is, if you have tried CBT once or twice or more with limited success, there is no reason you can't work with another therapist, perhaps an OCD specialist, and have a completely different experience. In the last section, we used a driving analogy to describe anxiety. Well, if we return to a driving analogy, CBT is a bit like learning to drive. Some people need one course of lessons, therapy, to pass their test, but others need 2 or 3 courses, perhaps with a different instructor, therapist. If they keep working at it, there is no reason to believe they can't eventually pass their test. In many cases, CBT alone is highly effective in treating OCD. However, for some, a combination of CBT and medication is a more effective treatment package, especially if there is comorbidity like depression. Medication can be helpful in reducing anxiety enough for a person to start and eventually succeed in therapy. But what is CBT? Cognitive behavioral therapy helps the patient explore and understand alternative ways of thinking and challenging their beliefs through behavioral exercises, Dr. Victoria Bream explains. CBT makes use of 2 evidence-based behavior techniques, cognitive therapy, C, which looks at how we think, and behavioral therapy, B, which looks at how this affects what we do. In treatment, we consider other ways of thinking, C, and how this would affect the way we behave, B. It's based on the concept that your thoughts, feelings, and actions are interconnected, and that negative thoughts and feelings can trap you in a vicious cycle. The principal aim of this therapeutic approach is to enable the person to become their own therapist and to provide them with the knowledge and tools to continue working towards complete recovery from OCD. What we know from research is that almost everyone has intrusive thoughts that are either nonsensical or alarming. The aim of CBT isn't to never have these thoughts, because intrusive thoughts cannot be avoided. Instead, it is to help a person with OCD identify and challenge the patterns of thoughts that cause their anxiety, distress, and compulsive behaviors. What therapy teaches the person with OCD is that it's not the thoughts themselves that are the problem. It's what the person makes of those thoughts and how they respond to them. CBT helps us understand the fears we associated with our thoughts, which can often be
Sample complete. Ready to continue?